Hello and welcome to this lecture for the Chrysalis Diploma in Counselling Skills and Theory. This is component 6, Development, Motivation and Goal Achievement. And this is module 10. Okay, so module 10. And now is the time that we really need to turn our attention to another important aspect of your training, which is self-development. And during the course of this year, you've probably increased your own self-awareness to a great extent and probably seen some changes. But through year 3, self-awareness and self-development, self-reflection is even more important. So that's what we're going to be looking at today. The professional self is a concept that's been explored through time by many different theorists, and they conclude that self-awareness and self-development are key aspects in your competency. So, why does the screen never want to move on? There you go. So the professional self is really made up of these 3 different aspects. So this year you've been learning a lot of different theory, and you've also been practicing and developing your therapy skills. But we need to also focus our awareness of ourselves and do the necessary work on ourselves in order to be fully competent in working with others. And if we're not prepared to do this work on ourselves, then it's unlikely we're going to make good therapists. So today we're going to look at several themes that have been explored within therapeutic literature, which can relate to the importance of our understanding and developing our own self-awareness. So one of those things we're going to look at is narcissism. Now, as a therapist, we're in a position of power, and we need to make sure that this doesn't go to our head. Our clients could be heavily influenced by us, but we need to make sure that we're in an equal relationship with our client. A narcissist is someone who has an overinflated ego, and there may be childhood patterns there that can create potential for narcissism. And that might be feeling that we're an outsider in our family, and that might give us the belief that we're better than other people, or having to be maybe the family peacekeeper from a young age can lead us to believe that we're especially important. So these are things that we tell ourselves that lead to that narcissism within our personality. And it's been called the grandiose professional self, presenting as an image of an all-powerful therapist. Someone described it as the God complex. To describe therapists who act as if they know everything. And of course, we don't know everything. even after we've been qualified for many, many years, we still learn from every client we have, and we continue to develop our own self-awareness and self-development, and we still need continuing professional development, as well as doing things that aid our personal development. So a narcissist is someone who won't readily accept feedback, doesn't like being criticised, deeply threatened by a client who might criticise them or become angry towards them. Someone who has perfectionist tendencies, may expect others to be perfect. And someone who seeks to impose their own truths on other people. And clearly, to be a good therapist, we don't want to be this way. We don't want to be narcissistic. We're not perfect. We're human. We have flaws. And we're not going to be a perfect therapist. We can't always be empathic, non-judgmental, and helpful to every client we see. We have a lot more to learn. It's a never-ending process. What we need is to be good enough. So how do we know if we're good enough? And how do we stay there? And that's basically through our own self-reflection, our self-awareness, our self-development. The use of supervision can really help with that. So, of course, we need to think about if we've got any of these narcissistic traits and be prepared to really work on ourselves. Now, we need to spend time with ourselves, and we also need to experience life as fully as possible, and sometimes put ourselves out of our comfort zone, because this leads to the best possible understanding of ourselves. Now, the idea of a wounded healer came from Carl Jung's work, and he believed that a big proportion of the work we do with a client is about the therapist self-examining and trying to heal himself, and that it's his own hurt that gives measure of his power to heal. So, in other words, a therapist often wants to be a therapist because they've been hurt in the past. They've experienced pain, loss, and suffering. And the presence of that wound gives them the empathy to understand others. They want to, therapists with their own wounds want to help other people explore and heal their wounds. A therapist that has been through difficult experiences is able to understand others' experiences and their search for wholeness and self-actualizations. If we haven't had any traumatic experiences ourselves, and we've had a very easy ride through life, would we actually be as effective as a therapist? So we need to be good enough. And to do that, we need to have sufficient knowledge, and we need to be competent in our knowledge and skills. We need to feel competent to help other people. And we also need our sanity. We need to be mentally stable, and we need to look after ourselves and care for ourselves. And we need to have addressed and healed our own wounds. So if we don't face our own difficult experiences and go through a recovery process, then we might be using our client work to either deny or suppress our own self-examination. And we might turn out to be a poor therapist. So if we're trying to become a therapist to actually heal ourselves, make ourselves feel better, then that's not really a good intention. We need to have worked through our own experiences from the past, and then we're in a good position to help our clients. So we need to question our own motives for becoming a therapist. You know, have you really worked through issues in the past? How much do you understand yourself? How much self-awareness have you got? Can you ethically and safely use your skills to help other people? So we know that drug and alcohol counsellors are often recovering from their own addictive experiences. Marriage and family counsellors have often been through their own relationship breakups or divorce. Rape and sexual abuse counsellors have often had their own experiences of abuse or assault. And eating disorder counsellors are often recovering from their own experiences with weight and food. So we know that if we've worked through our own experiences and difficult situations, that we can be effective as therapists because we can empathise well, we can understand others' pain, and we can then help them to achieve wholeness and healing. But we do need to make sure that we're not still avoiding our own issues from the past, that it's a way of trying to help ourselves by helping others, that we are in fact not still wounded. We've healed our own wounds and now we can help heal others. So part of the process of healing and wholeness is also accepting the parts of ourselves that we don't like or feel uncomfortable with. And that's quite a hard lesson to learn. Jung talked about a shadow side. That's the parts of us that we try to deny or hide from others, or we can see in other people, but we don't want to see in ourselves. And really, it's about becoming an integrated person. And when we've done that and we've had a positive recovery from trauma and we've shown a pattern of growth, then we may become a special therapist and be really helpful to our clients. But if we can't face our own recovery or process our own difficulties, then we may be a poor therapist who uses our client work to deny or suppress our own resolved issues. And we need to look at how whole we are, how integrated we are, how much we accept that we can't be perfect, that we've got some wonderful personality traits and some that are not so wonderful. And we need to balance our personality. So we know that those people that are really creative can also be really demanding. Those people that are scholarly can also be moody. Those people that are friendly can be easily hurt. Those good at business might be non-emotional. And those that are very caring to others may neglect themselves. So part of us being a good therapist is also being able to accept the parts of ourselves that maybe we don't like as much. We don't need to be perfect, we just need to be good enough, remember. So we need to be able to let go of guilt and shame. We need to be comfortable with who we are, because that's really what we're asking our clients to do. We need to be genuine, our true selves, and be comfortable with ourselves, because that's going to then help our client to be comfortable with themselves. So let's move on to look at relational depth. So we need to explore the depth of our experiences. And when we've been wounded ourselves, we may go to the depths of despair sometimes and feel very uncomfortable emotions. And we need to accept that that's part of the process. And when we're working with volunteers or clients, as you will be next year, the clients that seem to gain the most from therapy are those that are willing to really explore their own responses and the depths of their experience. But as a therapist, we also need to be able to go there with them. We need to be able to work at that deep level with the client. And we need to feel safe and secure to do that, and make the client feel safe and secure to do that. And again, if we haven't worked through our own past pain and difficult experiences, and we haven't been to those depths of our own experiences, how are we going to go there with a client? We don't just want to explore their issues at a surface level. We want the client to be able to explore their own emotions, and we want to be able to support them through that. And so we need to be willing and capable of taking that journey with the client and holding that space for them. So we need to be able to take people in. We need to reach out to people. We need to not be deterred by the client's need to self-protect. We need to be committed to congruence. We need to be transparent, and we need to be self-aware. We need to be able to offer something to the client that maybe the client hasn't experienced elsewhere. Often clients feel they can't open up to family and friends. They don't want to upset those closest to us. Or maybe they haven't got that support, anyone to really listen. We need to be able to offer them that supportive relationship. And we need to make sure that the process of therapy isn't being distorted or inhibited by us as a therapist. Because we need to be able to face the client's disclosures, their pain, their difficult emotions and experiences. And it's really important that we're honest with ourselves. And we need to be honest with our supervisor. Next year, you're going to be in placement, and you need to be honest with your supervisor and placement provider. If a client is affecting you, and you may realize that actually you haven't worked through your own experiences from the past, and you might need personal therapy, and you might not be able to work with certain clients because of that, and you may need to do more self-development. We want to be at the point where we're really working at that relational depth. And if we don't, we might find ourselves using strategies that allow us to pull back from the depths of a client's experience. So we could find ourselves cancelling appointments with them, forgetting to make a follow-up appointment, bringing a session to an early close, trying to make a session pleasant for a client, feeling the need to refer the client on, making yourself unavailable to the client, even to the point of handing in your notice at a placement organisation. We may change the subject. We might interrupt the client. We might try to appease them. We might freeze. We might fall silent. We might start talking about our own experiences. We might ask questions to try and direct the session. We may show avoidant body language or show anxiety, because that will also probably make the client change the subject. The client won't want us to be affected by what they're saying. Or we may not really hear what the client is saying, or use statements to make the client feel better. And a lot of this will be unconscious. It's not that we're going to be sitting there thinking, oh, I'm going to forget to make a follow-up appointment. But we might do some of these things because we don't want to go on that journey with the client. We don't want to go to the depths of their pain, their experience. So our own self-awareness and self-development will help us avoid doing these things and will allow us to work at that relational depth that's really needed for that client and to help them achieve that healing and wholeness. So let's move on to look at existential touchstones. So when you've been on your own journey of pain and suffering, difficult times, there's certain things that stick out as being really important points along the way. And these are, some might be good experiences and some might be bad experiences, but they're the things that have really led us to grow as a person. And we call these existential touchstones. And we've all got unique personal strengths. And these strengths often have their root in our childhood. and, as I said, can involve both positive and negative experiences. But those negative experiences should have been processed and understood as that wounded healer. And these touchstones give us unique qualities. And this is something that, you know, we can't be taught. It becomes part of who we are. And so sometimes you need your own personal therapy to learn more about yourself and your own touchstones, your own unique qualities, and the things about you that can really help a client. And although personal therapy is not compulsory on this course, it's really worth thinking about. And especially if you're ever triggered by a client into thinking about your own issues. And if you're not working at relational depth. So personal therapy can help you find your touchstones, but also a timeline. When you do a timeline, this can really help to outline the most important things that have happened in your life that have really affected you, but made you grow as a person. And there's just an example of a timeline, what somebody may have been through, good and bad. And, you know, they're the things that have helped the person to grow. So part of understanding ourselves is thinking about our past experiences and also being empathic towards ourselves. You know, we can empathy, although it's a natural trait, we can learn to be more empathic. And we also need to be empathic in our attitude towards ourselves. And things like keeping a journal, keeping a dream journal, a reflective thought notebook, they can all be useful things to do to help us reflect on ourselves. And obviously taking care of ourselves is important, our own health and well-being. And client work can be very demanding, and we need to ensure that we can keep our energy reserves healthy, not just for the client, but for our own well-being too. Our therapy work is just part of our life. You know, when you go on to work with clients and you're in placement, you're going to be busy doing that and studying at the same time. But there's also other things in life, and you need a social life and fun and creativity. And obviously our health is really important in that. Our well-being, we need to still make sure we have a balance in our life. And so we need to think about some of the tools and techniques that we've looked at this year that might aid our own self-awareness and growth. And tools such as the Wheel of Life, doing that at regular intervals to see where we are and how balanced our life is useful. CBT thought records for whenever we're having negative thoughts. And the relationship diagrams. Where are we with our relationships at the current time? Oh, didn't want that one. And as I said, looking at where you want to go in the future as well. So doing a motivational ladder, setting goals is also useful, because if you don't know where you want to get to, how will you know when you get there? And now is a really good time to start thinking about what you've learned in module 2, maybe going through and reviewing the material for year 2, using some of those tools that I've mentioned, and setting out goals for your future. In year 3, you'll start building on your knowledge and your skills and examining some more of the theories and more ways of working with clients. And you'll start working with real clients in a placement, and there'll be policies and procedures to adhere to, and you'll have regular supervision, which will be so beneficial and guide you. But aside from your client work, you'll also still be working with your peers in class and learning new techniques. So as we're moving into year 3 shortly, it's really time to also understand that there are lots of client issues that you can't work with at the current time. There's only certain things you can't work with, you can work with, sorry. And as you move into year 3, you'll be working with more complex issues. But even so, you still need to make sure you're working within your own competency levels. And so it's really important to be aware of psychopathology. So let's just look at this. So psychopathology is the scientific study of mental disorders, and it differentiates between normal and pathological psychology. So while being a reflective therapist is key, an understanding of psychopathology is important. And the National Institute for Health and Care Excellence have recommended treatments for different types of disorders. And people with complex disorders may be under the care of a psychiatrist, a psychiatric nurse, or a psychologist. And while medications can be effective for some disorders, not all disorders respond to medication. And for some people, a combination of medication and psychotherapy can be effective. And a client may need referral to a GP, to a mental health team, or to a more experienced therapist. An experienced supervisor is the first port of call. So it's not always clear when a client first comes to therapy exactly what their issues are. And the initial assessment is really important. Doing a really thorough initial assessment is really important to try and gauge whether this client is someone that you can work with or not. And even if a placement refers somebody to you, it doesn't necessarily mean that you're going to be competent enough to work with them. You need to think about your levels of competence and confidence. But it would be unethical to work with somebody who has got complex issues and are under the care, or should be under the care, of a psychiatrist or mental health team. And if you have any doubts about someone and recognise any signs that could be pathological, could be something more complex, such as bipolar or a personality disorder, then it's really important that you talk to your supervisor, your placement, about the need to refer to a GP or a mental health team, or at the minimum to a more experienced therapist. So it's important to recognise signs of psychopathology so that it can be discussed with your supervisor, and so a referral can be made if necessary. And some of those signs are changes in mood, excessive worry, anxiety or fear, feelings of distress, an inability to concentrate, irritability or anger, low energy or feelings of fatigue, sleep disruptions, changes in eating habits, thoughts of self-harm or suicide, trouble coping with daily life, and withdrawal from activities and friends. So just some signs to look out for that could indicate that someone has a more complex disorder and needs referring on. So how is psychopathology identified? Well, by deviance, distress, dysfunction, and danger. So deviance refers to thoughts, emotions, and behaviours that deviate from what is common or acceptable in society. And distress refers to negative feelings felt within the person or that result in discomfort in others around the person. And dysfunction, professionals are looking for the inability to achieve daily functions like going to work. And danger is obviously about risk, the risk to the person themselves or to someone else. And there's various categories of disorders that come under psychopathology and that you certainly wouldn't be able to work with in placement or even when qualified, because you may need extra training if you really wanted to work in this field. So there's various anxiety disorders, mood disorders such as bipolar, substance abuse and addiction, impulse control disorders, schizophrenia and psychotic disorders, depressive disorders, dissociative disorders, eating disorders, personality disorders, obsessive compulsive disorders, holding disorder, neurodevelopmental disorder, and trauma and stress disorders. And we just need to finish with a little bit about psychopharmacology, which is the study of substances that influence mental states and induce changes in mood, sensation, thinking, behaviour. And they may be plant-based or chemically synthesized. And these encompass medications used in the treatment of depression and anxiety and psychosis. And it can also include agents that relieve pain and curb insomnia and facilitate sleep. And you can find details about specific medications from the National Institute of Mental Health and the National Alliance on Mental Illness. So, you know, this year you haven't been able to work with clients on any medications for depression. And next year, when you're in placement, you may be working with clients that are depressed or anxious and are on medication. And it's important to just have a basic understanding of various medications that people may be on. Obviously, you can't have any say in what medications they are on or give any advice about medications, but just having a general understanding of what some of the medications are and why they might be prescribed for somebody can be useful. So it might be a good idea to just look up the categories of medications so you understand that a bit more. And we have antidepressant medications, and they're normally prescribed for depression and long-term anxiety, and antipsychotic medications for psychotic symptoms like delusions and hallucinations. And there's mood stabilizing drugs which help for things like bipolar. There's psychostimulants which are used for ADHD, for example. I can never say this word. Anxiolytics, which are sedatives, anti-anxiety medications used to calm short-term anxiety. There's central nervous system depressants, which induce sleep. Various substance abuse medications, which aid in substance withdrawal. And cognitive enhancers, and they're for things like Alzheimer's and dementia. And you don't need to have a huge understanding of these different drugs, but just recognizing some of the different medications that people may be on and why they've been prescribed can just be useful for you. And to finish, we need to just look at those ethical considerations involved in that, because counsellors cannot diagnose mental health conditions. So if you see any client at all that you think might have a more complex disorder, you're not trying to diagnose them. It's a simple case of discussion with your supervisor or your placement and a decision as to whether to refer to a GP, a mental health team, or a more experienced therapist. And you cannot offer any advice about medications. If a client says to you, oh, I'm thinking about reducing my medication, then it's referral back to the GP to discuss that with the appropriate person, not you. And many people with more complex disorders need to be under the care of a psychiatrist, a mental health team, alongside possible medication. And it's extremely important to work within your own competence levels. To work with more complex disorders, you would need further training in this area. And risk assessments are even more important when you're working with these more complex disorders, as the risks of self-harm or suicide increases. So something to be aware of as you go into year 3 and as you go into your placements. And if your placement gives you specialised training in these areas and you're getting regular supervision, and you might be working with somebody who may have bipolar, who may be very stable on their medication, and where it's considered that psychotherapy can be of benefit. But again, it's also for you to decide, am I competent enough to work with this client? And you should never take on any client that you think is too complex for you. So now you've more or less completed year 2, and you'll be moving in to year 3 to increase your knowledge and skills, and get lots of practice working with clients. And it's important to make sure that you have got professional membership and professional insurance, and to take some time before you go into year 3 to do some self-reflection on how far you've come, and think about some of the things we've discussed today. And obviously, when you go to class, you can talk more about some of these issues. But for now, let's stop sharing my screen. For now, it's cheerio from me, and I'll probably see you again soon. Bye for now.